today that a few different themes or exercises are going to cross over with some of our other workshops. And the reason for that is I think it's going to kind of drive home the theme that we are not fragile. Our tissues are really strong and robust, but they are very sensitive. So we have a number of tissues in the body that with minimal amounts of actual damage can create maximal amount of pain and limitation in your daily life, okay? So a big amount of pain doesn't necessarily mean a big amount of damage. There's always red flags involved, as in, trauma or things like that, but in most cases, the severity of our pain does not mean we're more or less broken. And that's why we look at exercise or movement as a way to deal with it. Another thing why you'll see a number of the exercises or themes kind of crossing over from different workshops is that whenever you have an area that needs attention or that you're trying to work on, it's going to involve some improvement to neighboring areas. Okay, so for instance, in my low back, I need to make sure my hips are moving well. In my neck, I'm going to be looking at the shoulder, and in the knee, that's exceptionally important. We'll go into a few specifics as to why with that. So, knee pain has tons of different causes, and it's a really common thing. We do see a lot more sedentary-based knee pain conditions than activity-based. However, that really depends on our age group, our age category. But there is certainly in the knee an equal amount of activity-related and inactivity-related causes of knee pain. Some of these causes may be trauma, so a direct hit to the knee or a fall or a slip, or a car accident. Also wear and tear can play a role in this sort of thing. A massive amount of activity, so significant overloading. Underuse is actually probably our biggest. And when I'm talking about overuse or underuse, I want to discuss that a little bit in a second, because I'm not a huge fan of those terms. Also infection in the knee, referral coming from other areas. So specifically, if we're talking about the legs, could be coming from my hip. If I'm young, patients or people under the age of 10 maybe with a hip condition may just feel aching knee pain, or it could be coming from my lower back, from the nerves stemming from my lower back and hip region. So where my pain is doesn't always mean that's where there's an injury or a specific issue. And again, there's a ton of different things that can cause pain within the knee. There's many different structures involved, what we call pain-generating structures around that knee. Again, can be very sensitive, not always that fragile. And it's really, really important to consider the why these conditions or these tissues are sensitive, okay? And when I mean the why, I mean what is the cause? Just because I have pain on the outside of my knee or the inside of my knee or on my patella, which is my kneecap, or in my quadriceps tendon, or on this spot or that spot, if it's not traumatic, meaning I didn't get cleaned out by someone's dog or playing the contact sport or something like that, and I'm just developing that knee pain, there might be a specific functional limitation or strength limitation that could manifest as pain in a bunch of different structures. And trying to continually poke and hammer and work at that structure may not give me the relief, where if I fix that dysfunction or fix that why, now all of a sudden those different pain generating structures aren't as painful. And we'll get into what I mean by that in just a minute here, okay? So most of our cases of knee pain, like I mentioned, are non-traumatic. Okay, so it means they're not a sports injury. Again, this is going to depend on the population of the person as well as the age group. And they almost always are going to involve dysfunction or an issue from a neighboring area. Okay? Maybe it's excessive stiffness or weakness, or what we would call instability, so too much movement, causing tissues of the knee to be overloaded, overused, or irritated. Okay? And when I said overused and underused, generally the term I like to go with is misused. because if I'm not using my knee well, and it's causing it to be overused, I'm probably just not using it well, right? I know that sounds a little weird, but maybe I haven't done anything. Maybe I've been a couch potato for 10 years, or I've worked a relatively sedentary job for a long time, and I decide, you know, it's January 1st, I'm going to start a running program, or I'm going to start a weightlifting program, and I start going and doing this activity 4 times a week. I just increase my activity of those knees or those areas by a massive amount. So it's not necessarily that working out or doing that 4 times a week was too much. It was too much too soon. I was misusing those tissues. So I wasn't necessarily overusing them, I was just not using them appropriately for myself and my fitness level and my activity level. We'll go through some of the anatomy of the knee a little bit, and that'll lead us to some principles, and then we'll dive into some moving. The knee is a very strong and stable hinge joint. Okay, so it moves kind of like your elbow. It is a hinge-based joint. It is very long levers. Okay, so my thigh or my femur and my shin or my tibia. Okay, big long levers, great big joint surface. It's actually the largest joint of your body as far as surface area. And has really large muscles. Really long, powerful muscles crossing that knee, creating a lot of force. A lot of compressive force, a lot of movement-based forces. Okay? There's 3 specific joints that actually make up your knee. The knee joint proper, or the main one that we think of, is what's called my femoral tibial joint. So between my femur or thigh bone and my shin bone. The other one's going to be just off to the side, and this is my tibiofibular joint. It is not a weight-bearing joint. It is more of a rotational, kind of torsional joint. And the last one would be between my kneecap and my femur, called my patellofemoral joint. Okay? So 3 joints that make up the knee in total. With that, we're going to have a lot of different ligaments involved, and joint capsules, which are sturdy but very sensitive ligament-based tissues. So the main ones of the knee, you've got one on the outside, one on the inside, 2 deep inside the middle that kind of crisscross. There's a number of other ones in there, but that is kind of the main ones that we think about. And what these do is provide stability to that knee in what we call a passive aspect. So if I'm asleep and you're moving my knee, it's going to have a position that it stops at no matter what. So my ligaments and my joint capsules are very sensitive, and they give structure or passive stability to my joint. My muscles and tendons are active tissues. They contract and shorten and relax and lengthen, and they are going to give me what's called active stability, meaning that they help me control or stabilize, transfer, or dampen the force that goes across that joint. And that's a very important thing, regardless of the injury. I want to make sure that those active tissues can do that job, so that I'm not continually putting a beating on some of those other areas. Okay? When we're talking about muscles and tendons, the 2 major kind of tendons that I want to keep in mind if we're talking about knee pain are going to be the patellar tendon, which is right under your kneecap, attaching to kind of a lumpy bone on the front of your shin. It's also called your quadricep tendon. All 4 big muscles of your quadricep come right down, engulf your kneecap, and attach right there. So 4 great big muscles, 1 little tendon. Big, powerful tendon, but really about this big. Okay, and that's a pretty common pain generator for knee pain, especially if it's in the front. The other ones are going to be the hamstring tendons. So if I reach behind my knee from either side, you're going to feel kind of guitar strings. And those are going to be my hamstring tendons, both of which are actually going to come down from the back of my thigh and attach into the front and side of my knee like this, actually kind of enveloping through the front of that bone. Okay? So a lot of the times an issue with these muscles may manifest as knee pain in these regions. Okay? Because I'm getting pain where that, in that tendon where it attaches. Maybe it's because of excessive tightness in the muscle back there, or weakness in that muscle. For whatever reason, it's putting more strain and pull into those guys. So a lot of the times the location is important. We want to think, okay, what is there? because our knee's pretty bony, you can touch quite a bit, right? There's not a ton of flesh over top of it. So oftentimes, if it's pretty sensitive on those areas, you can feel bone. And if I didn't get whacked, I know that I probably don't have a broken bone. So what else is attaching there? And then I can think, okay, that might be the structure. That might be what's actually bugging me. Why is that the case? After my muscles and tendons is going to be my nerves. In the knee, this is really important. If I'm having pain on the front and inside of my knee, let's say from the kneecap down, it's really going to be involving one specific nerve, which comes kind of right out from in here after traveling from the front of my hip and down, and spans all the way across the front of my knee like this with a bunch of little branches. So the whole reason I can feel any of the skin in the front of that knee is this nerve. And it's pretty common to get a little compressed or irritated through some of these structures on the inside of the thigh. Okay, and we'll talk a bit about why that can be the case, but the most common thing we see with people with knee pain here is an inability to control where that knee is going. Maybe it's, like I mentioned, an issue in one of the neighboring areas, like the hip or the ankle, but I'm adding increased force and stress to that area. Maybe that's irritating that nerve and I'm getting some of that sharp pain across the front. Other nerves are going to be my femoral nerve. I know the names are a little bit wonky, don't worry too much about that, but the femoral nerve, again, comes from up here, innervates all of my quadriceps. So the whole reason that I can extend my knee is because of my femoral nerve, and it can create pain or dysfunction or weakness into a number of those areas. Lastly would be my tibial nerve and fibular nerve. Those are the two big branches of my big sciatic nerve. Right about here they branch. Tibial nerve is going to be right behind your knee. You might feel like a big guitar string that's really sensitive. And the fibular nerve is going to come off the side and down the outside of the shin. So if I'm having knee pain in one of those areas, maybe that's lending me a bit of an idea. Am I irritating one of those nerves? Is it coming from up higher? Something to consider if we're thinking about, okay, what is causing my knee pain specifically? And lastly, there's a couple of miscellaneous or kind of random structures that are really important and frequently pain-generating or irritating structures in the knee. One of them is called a fat pad, and we have fat pads in a number of different areas. One area is going to be your heel. So under your heel, one is behind your elbow. Really, fat pads are just in areas that need a little bit of cushioning and possibly to keep tendons from rubbing on other things. So behind that patellar tendon, so under your kneecap, kind of right off to the sides there, you can feel little divots. That is, it's called Kager's fat pad or retropatellar fat pad. There's a ton of different names for it, but it is a really, really sensitive tissue and can oftentimes get what we call impinged or pinched by tension in some of those structures or by the way I move that area. So again, this is going to be pain more below or in front of the kneecap, not necessarily above it or off to the sides, but oftentimes it's pretty easy to feel because when it's sensitive, it'll hurt. Sometimes it'll be a little puffy or swollen, and you touch it, and it's like, wow, that's my knee pain. And there's a couple of easy things that we would do if we're taking a look at it to see if that's really the case. But you can't really treat an irritated fat pad if it's inflamed. Generally, you want to ease off of it. But like I mentioned before, I want to figure out the why. If I figure out why am I irritating that fat pad, am I too tight somewhere else? Am I loading it funny? Am I doing something like that? If you fix that why, a lot of the times you'll decrease that irritation through that tissue. The next kind of miscellaneous tissue is your meniscus. You've probably heard a bit about this if you have knee pain or have had knee pain. Your meniscus is a kind of crescent-shaped shock absorber. It's a cartilage tissue that is in between your femur bone and your shin bone, your tibia. Okay, and the meniscus kind of sits there and allows the bone to give a little bit of cushioning or shock absorption, but it is mobile. It has a little bit of movement, and I'll go over that in a second in one of our principles, because health of my meniscus really is determined by how much or how well I can control some of this movement. So the meniscus is a big one for kind of chronic ongoing knee pain as well as traumatic knee pain, so it's something to keep in mind. If it's not traumatic, if I didn't get cleaned out in a football accident, and I just had some ongoing knee pain with activity and it's involving my meniscus, I can't fix the meniscus. I can oftentimes fix the why. Why is the meniscus getting sore? And a lot of the times that pain will go away. Okay, so treating our knee or fixing our knee is more about improving the function of the area, and oftentimes the pain structure will feel better. And again, we'll go through that in a second. So those are generally our tissues. I know that was a lot to handle. Again, this will be available on YouTube, and we'll have a couple things in a handout that we're going to send you guys after, possibly tomorrow or later this weekend. It'll go over a couple of those things a little bit more in depth. So we're going to go through some of our principles. The first one is, again, it's involving that meniscus, and what it is rotation. So I mentioned that your knee is a hinge joint, but it is not a strict hinge like the hinges on your door. Your knee has a little bit of rotation, okay? And it's a really important movement. Rotation of your knee allows unlocking of the knee joint. So if this is my femur and this is my shin bone, my tibia, it doesn't bend like this. It actually bends like that, where there's a little bit of a turn and pivot before it bends. So it's not a straight hinge. There's a little bit of this, where it turns and unlocks. It's called the unlocking mechanism. And when that happens, when that little bit of rotation happens, there's a bit of movement of that shock absorber called the meniscus. Okay? So if I am failing or really struggling at that rotational aspect, maybe that's a reason why I'm creating impingement or irritation to my meniscus. So rotation of the knee is really important. Another big reason it's so important is your knee is trapped between two very mobile rotational regions. My hip and my ankle have a ton of rotation and movement, but the knee has a little bit of rotation and it's pretty happy in that kind of straightforward stuff. So I need to be able to transfer and control that rotation across that knee. If I have zero ability to rotate in my knee, it's going to lead me to more injuries involving rotation. And some of our worst traumatic or sports injuries of the knee are a plant and twist type mechanism. So that twisting, which loads some of those structures. So if I'm capable of having some of that rotation there, I can decrease some of the likelihood of those forces being really injury-causing or traumatic. Okay? We're going to go through an exercise that's fantastic for working on some of that rotation. The next principle is our kinetic chain. When I talk about kinetic chain, what the kinetic chain means is just series of areas or areas in sequence that move together or depend on each other through movement. So my kinetic chain of my leg is going to be my foot, my ankle, my knee, my hip, my pelvis, my lower back. So when I step, I use all of those things to create movement, to stabilize, to dampen force, and to transfer force to other areas. And the function of that kinetic chain is extremely important in maintaining the health of certain parts of it. In the case of the knee, as I mentioned before, the majority of our non-traumatic, so no hit or contact sport involved knee pain, has a major contribution from a dysfunction in some of those neighboring areas. Control of my foot and my hip are absolutely paramount to having a healthy knee. Okay, they determine where and how that knee is going to move. Okay, because it has mainly that bend back and forth, a teeny bit of rotation, but the hip and the foot and the ankle have all kinds. So a lot of the times that mechanism that's hurting my knee, that why, might be because of something the ankle and hip should be doing better. Okay, so something that's really important to think about. A big part about that is our hips and our ankles are really prone to being quite stiff or weak. Generally because of the sedentary lifestyle that a lot of us have, even if we are quite active, we do spend a lot of the time in a seated position where the hip and the ankle are pretty much nullified, not really doing much at all. And that leads them to getting a little bit stiffer or having a little bit less control of their movement. And now some of those other areas or some of those other activities might be creating pain at my knee, when really it's those areas I want to put more focus on. So, building that control is really, really paramount. If we're looking at an activity like running, improving my kinetic chain is really one of the most important things. When I run, the two areas that get the most force or the most load or do the most work in the running stride are your ankle and your Achilles tendon, and the knee or the quadricep tendon. Okay? So a lot of times in just running and jogging, that's the biggest thing. The knee and the ankle are the most important. The hip actually doesn't go through quite as much force. If I'm sprinting or hurdling, that's a little bit of a different story. But in general, if I'm looking to strengthen anything for running, I'm probably going to put focus on my knee specifically and my ankle. Okay, and I'm going to encourage maybe some good mobility through my core and my hips, but really want to make sure I'm nice and strong and robust to that ankle tissue and that knee tissue. Okay, so that kinetic chain is very important to developing knee pain as well as fixing it. Third principle, it's called eccentric loading. Eccentric loading or eccentric loading, eccentric loading. What it means is loading a muscle tissue as it lengthens. Okay? So if we're talking about my bicep, which bends my elbow, if I grab a weight and I pick it up, that muscle is shortening. Okay? If I hold a weight that I can't lift and I can just keep it still, that muscle is not shortening, but it is contracting, it's squeezing hard. Neither of those are eccentric. If somebody passes me a weight, a really, really heavy weight that I can't lift, and I grab it and I slow it down before it hits the ground, that muscle is lengthening under load. And you are more powerful, you can produce more force eccentrically than you can with the other two mechanisms. For instance, I can pick up, say, a 100-pound bar and do that. But if Joe Steroids comes to give me a 250-pound bar, I can't pick it up. All of a sudden, I'm doing this, and I can slow it down on its way down towards the floor. Okay? So when it comes to our injuries of our soft tissues, like our tendons and our muscles, especially if we're talking about the knee, most of our soft tissue injuries happen during the lengthening part of the movement. So my hamstring is probably not going to pull or tear when I do this. It's probably going to pull or tear when I do that. Okay, so I'm more likely to injure those tissues as they lengthen. And if we're talking about running, walking, jogging, or sport movements, in the knee, my quadricep, my ankle, my Achilles tendon, my calf tissue are lengthening when I strike the ground. Okay? And if I'm walking or jogging or running, I'm doing that movement probably thousands of times, depending on how far or what distance I'm using. So quick lengthens of that tissue over time may be enough to create some irritation to them. Okay, so eccentric loading is where most of our injuries occur. So it should be where we put a big focus on our rehab or our strengthening, or if you're not necessarily considering a super active lifestyle and you just want to feel better, it's going to improve range of motion, joint health, and encourage basically bulletproofing some of those areas. So the strength exercises we look at today are going to be based on eccentric loading of some of those areas. Okay? When we do them, if I'm using the eccentric loading protocol, I'm moving very slowly with great control, with weighted lengthening of the tissue. So loading it and lengthening it very slowly and under control. It is massively effective, so I can do a program with a couple exercises for a certain area, minimal time involved, with maximal effect, and little to no equipment. Usually your body weight is enough to do this because I'm just simply adding time to increase intensity. So these are a huge thing to keep in mind, because if I'm getting pain during an activity like running or like distance walking or hiking, these are going to be something that might take that away as I start to get stronger in those exercises. Our last principle is one that we've kind of gone over quite a bit through all of our workshops, and that is going to be more involved in our inactive knee pain. More the when I sit too long, my knees get achy. When I'm not moving, my knees get achy. Stiff and achy joints need to move. When you move a joint, when you bend any joint in your body, you're moving the fluid inside that joint. It's called synovial fluid. It lubricates and nourishes the tissues inside the joint, the cartilage of the joint surface. When it is not moved, it becomes stagnant and inflamed. Okay? When this happens, it creates spasm and tension of the muscles around the area. If I have a muscle that's grumpy, kind of doing this, it's grabbing on, it's tight. It is hypoxic, it's not getting excellent blood flow. So when I contract and relax and contract and relax and contract and relax that muscle, I'm pumping blood into it physically. It'll turn red to looking at it, and it'll feel warmer to the touch. So if my knee pain or my pain anywhere is related to stiffness and aching when I am not active and feels better as I'm moving, odds are I just need to be moving this more. It's a pretty simple principle. Again, most of our knee issues are going to be non-traumatic, usually based in activity. The last thing, the knee is very much prone to injury because it is very, very weight-bearing. It's one of our most highly weight-bearing joints. And it has, like I mentioned, very long levers, okay? Which means that there's a lot of forces that go across there. Okay, great big long femur and great big long shin, I mean, that's a lot of area going into one joint, a lot of force going into one joint. But the knee is prone to pain. One, because of those two things, long levers and a lot of weight bearing, but two, because of its mobile neighbors, the ankle, foot, and the hip, okay?